Hello, this presentation is by Group 7, which includes Yesenia, Natividad, Jane, and Claudia, on a new drug, Rukobia. The reason we decided to do our presentation on Rukobia is because we as a group thought it was important to showcase a drug that is assisting in a lifetime battle with the virus that has infected 38 million people worldwide, with 1.2 million people in the United States alone. We also thought it was important to showcase the progress of new drug treatments for this virus. Although this is not a cure, it does take us one step closer to one.
Origin and history of Rukobia. Rukobia is FDA approved. It was approved on July 2nd, 2020. Its dosage form is an extended release tablet. Rukobia was created and released by the VIIV healthcare company for the treatment of HIV infection. Rukobia was approved by the Food and Drug Administration as a new type of antiretroviral medication for adults living with HIV who have tried multiple HIV medications and whose HIV infection cannot be successfully treated with other therapies because of resistance, intolerance, or safety considerations. Failing ARV regimens can leave some heavily treatment-experienced patients struggling to maintain virologic suppression, at increased risk of transmission, at high risk of progression to AIDS and death.
We are going to review the clinical trials for the new drug that was approved last year by the FDA, Fostemsavir, which is also known as Rukobia. The clinical trials that were conducted have over 100 sites in 23 countries that include North America, South America, Europe, Australia, Taiwan, and South Africa as well. The 272 randomized patients that participated in the clinical trials range in age, sex, and race. Rukobia is a drug given orally in tablets twice daily with a combination of other approved drug treatments for HIV-1. The information for the clinical trials state the drug works similar for men, women, all races, and in patients under 65. Patients 65 and over could not be determined because there were only 10 patients of the 272 that were 65 years and older. Because this patient sample size was so small, it could not be determined that this drug could work effectively for all or a majority of patients 65 years and older. The reason they could determine the drug worked in patients 64 years old and younger was because of the age group sizes. There were 162 patients that were from ages 18 to 49, as well as 100 patients that were from the ages 50 to 64 years old. I would like to move on to side effects. Some of the more serious side effects that can occur when taking Rukobia can include IRIS, IRIS, which is also known as immune reconstitution inflammatory syndrome. This is the inflammatory reaction that can be mild or life-threatening. Other serious side effects can include heart arrhythmia and increased liver enzymes. When heart arrhythmia occurs, it can cause your heartbeat to be fast, too slow, or irregular. With the side effects that increase liver enzymes, this may only occur in patients who have hepatitis B or C virus. The clinical trial states that side effects were similar in men, women, and all races, as well as patients under 65. Again, patients 65 and over could not be determined because the participant size within the clinical trials. The benefit to Rukobia is the reduction of the viral load HIV-1. Some additional side Some additional side effects that can occur when taking Rukobia can range from nausea, diarrhea, headaches, abdominal pain, indigestion, heartburn, sleep disturbance, vomiting, as well as a rash. Although these are more mild side effects compared to the more severe side effects, you should still notify your doctor if they do occur, because this can lead to things such as infection or even lead to the more severe side effects as well.
I'm working on I'm working on disease process and new drugs and how they work. And the new drug is Rukobia, which is a drug for HIV. Ricobia prevents human immune deficiency virus HIV-1 from interacting with host immune cells by binding to the cell envelope protein GP120, leaving CD4 plus T cells untouched. Fosmaserv is a prodrug of its active moiety Timoserv. The attachment of TEMSERV locks this GP120 into closed formation that prevents the initial interaction between the virus and host immune cells. It stops the virus from replicating in the body and further allows the immune system to repair itself and prevent further damage.
So for the next slide, we're going to talk about how you get Rukobia. How do the patients have access to this prescription? Well, Rukobia is a prescribed medication that you need to get a doctor to write a prescription for. Patients, after they receive their prescription, they have to register online as a new patient to enroll with Viv Connect. And this is a process that they have to do for the prescribed Viv medication. They have programs for eligible patients who are insured, underinsured, and uninsured. They do take commercial insurance, so some of the insurances cover the cost of the medications, and they do offer discounts to patients who do not have insurance. With new medications, there may be some disparities, and some of the disparities that may be an issue in accessing this new medication are the high prices. The cost of this medication is very high, and for most people, they don't have insurance and may find it difficult to pay for the medications out of pocket. Another issue that might arise is you need to see the doctor to get a prescription, and some patients may not want to go to get their prescription filled. Some people may find it inconvenient to go through all of these steps just to get the medication. And also, racial disparities are found in having usual source of care. More accessibility should be devoted to people with socioeconomic needs to improve their access to continuous availability to their medications.
To conclude Group 7, To conclude Group 7's presentation, we wanted to add the following questions to determine how to improve Rukobia overall. Questions to look at would be, if medications are not one fits all type of medications, then how could Rukobia be better effective? Because everyone is an individual. Another question would be, in the drug trial snapshot, it is said the drug has no difference in how well the drug worked with different age, race, and sex. Maybe the drug could be more effective if it is adjusted between sex, age, and race. Another question, which I think would be the most important, would be how could lower class people afford the drug, especially if Medi-Cal coverage denies them because of their condition, if a 60-day supply is almost $8,000? One last conclusion question would be, will there be a drug trial targeting patients 65 years and older, or will there be a target treatment similar to Ricobia since their sample size was so small and the drug could not be determined if it would be effective for patients 65 years old and older?